What started as a routine funding hearing instantly spiraled into chaos when Senator Patty Murray accused HHS Secretary Robert F. Kennedy Jr. of illegally withholding billions, only for RFK Jr. to fire back with a shocking accusation that forced the chair to step in.
You both again in this Congress. Secretary Kennedy, things are not going well. It's clear what you are doing across HHS is devastating to children, families, seniors, millions of Americans that HHS programs support. Now, you were required to send us an operating plan detailing how you are spending funds that Congress provided for programs that families rely on. You sent us what you titled the, quote, Hill version, which had over 530 asterisks in place of the funding levels. Mr. Secretary, we need the real version with actual funding levels. This committee needs to know how you are spending taxpayer dollars right now and what programs you are cutting and which you are eliminating. You are blocking billions in funding that Congress appropriated from going out the door, including $3 billion at NIH, $1 billion in Head Start, and $3 billion in childcare funding alone. And that's on top of all the other funding you have illegally ripped away. $11 billion from state and local health departments, $1 billion supporting local substance use and mental health programs, and $66 million in Title X funds for cancer screenings, birth control, and preventive care. We know you're dismantling HHS and throwing away generations of investments in our healthcare system and firing critical employees. We are talking about the people who administer Head Start, LIHEAP, Meals on Wheels, or entire teams who are working on preventing chronic disease and Alzheimer's, tracking IVF success rates and safety, maternal health, more. On top of all of this, you propose a budget now with truly devastating cuts that would leave America sicker and weaker. But you're not waiting to see whether Congress approves that budget proposal. This administration is starting to unilaterally implement it right now, in defiance of Congress and the laws we passed. If you aren't already, you're sprinting down the road of illegally impounding billions in funding through intentional action and incompetence. So to my colleagues on this dais, we heard several weeks ago from experts across the country what we risk by ceding American leadership on biomedical research. If we bless these staffing and funding cuts across HHS, that means deciding that we are comfortable with China leading the future development of every drug, device, and vaccine. The supply chain challenges we faced during the pandemic will be the new normal. Our access to the latest treatments and cures will depend on other countries. It's time to stand up and assert Congress's authority. This committee has dedicated itself in a bipartisan manner over decades to make sure we are the global leader in research and development. And now all of us know this administration is now setting us back where it may take decades to regain that position. If we don't, decades of scientific breakthroughs and medical discovery and the bipartisan work to support them risks being burned to the ground, and it will be very, very hard for us to rebuild that. We should be setting this country up for failure. We have to do better. Now, Secretary Kennedy, listening to your testimony last week, frankly, left me pretty confused and concerned about what is happening at your department. You repeatedly claimed that staffing and funding cuts that have been reported on publicly and even confirmed by your department staff are not happening. So either you're lying or you're not the one making the decisions. You said, and I quote, "I made sure that Head Start was not cut," later going on to say there should not be any delays, the funding is there. Well, Mr. Secretary, HHS is delaying billions in funding for Head Start and childcare. These funding delays meant that a Head Start program in my state that serves more than 400 children had to close its doors and left parents scrambling. So let me ask you about another childcare issue. Secretary Kennedy, whose decision was it to withhold childcare and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation of me, and I'm going to answer it.
Okay, I appreciate
On May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can.
And I also want to point out.
I have just 2 minutes left. I asked you a specific.
I want to point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
our people are now the sickest people in the world.
Seriously,
because you have not done your job.
Seriously. That is an
What have you done about it? What have you done about the epidemic of chronic disease?
Mr. Secretary,
what have you done about the epidemic of chronic disease?
Seriously, Madam
Secretary,
Chairman.
I would ask you to hold back and let the Senator ask the questions.
Mr. Secretary, I'm asking you a question about childcare. I'm asking you who made the decision to withhold childcare and development block grant funding.
That was made by my department.
Okay, and you said last week, quote, "We were not cutting thousands of scientists. We are not cutting clinical trials. But I want you to know in the last 4 months, you fired or pushed out nearly 5,000 NIH staff and terminated more than 1,600 NIH grants. That includes more than 240 clinical trials across the country. So whose decision was it to fire scientists and terminate these NIH grants and the clinical trials?
Senator, I don't trust your information with all due respect. You told me 3 days ago or 4 days ago that we had cut a clinical trial in your state, and what you said turned out to be completely untrue, and you knew it was untrue because you corresponded with Jay Bhattacharya before
Madam
that.
Chairman, I will answer that. It shouldn't take me, first of all, raising an issue with you face to make sure NIH is working its way through this. The woman that was in question, as I clarified to you at the last committee, was qualified for a clinical trial, unlike you stated. So
Untrue. Untrue.
No, that is true.
Untrue. She qualified this week. We shouldn't be talking about patients' private information.
I agree.
Anyway.
And let's leave that. And I will just say your staff didn't get back to me until 45 minutes ago.
We have the emails. We have the emails from your staff 2 weeks ago. 2 weeks ago, you were corresponding. What you said you knew was untrue when you said it to me.
You came here to argue with me. I came here to ask you questions about your budget request. Your budget request is asking us to cut dramatically, but I am also making the point that Senator Baldwin made, that what you are doing right now is enacting your budget that Congress has not passed by cutting critical funding across the board. And I think this committee will find that to be very detrimental in the future. Thank you, Madam Chair.
This Senate clash cuts to a defining question about accountability in government. Who controls taxpayer dollars once Congress appropriates them? Senator Patty Murray pressed HHS Secretary Robert F. Kennedy Jr. over an operating plan sent to lawmakers that replaced actual funding levels with more than 530 asterisks, effectively obscuring where billions in health funding were going. Murray warned that the department is currently blocking funds already approved by Congress, including $3 billion for NIH, $1 billion for Head Start, and billions more for childcare programs. These delays, she argued, are already having real-world consequences, like Head Start centers shutting down and leaving hundreds of families scrambling for alternatives. She also pointed to the firing of thousands of NIH staff and the termination of over 1,600 research grants, including hundreds of clinical trials. According to Murray, these decisions risk dismantling decades of bipartisan investments in biomedical leadership and could leave the U.S. dependent on foreign nations for future drug and vaccine development. But instead of directly answering her questions about childcare block grants, Kennedy pivoted and escalated. He accused Murray of presiding over the long-term decline in Americans' health outcomes, claiming lawmakers had failed for decades to address chronic disease. The accusation immediately shifted the tone from oversight to confrontation. As the exchange intensified, the chair had to intervene to restore order after Kennedy openly stated he did not trust Murray's information. Murray pushed back, insisting the administration was implementing sweeping budget cuts that Congress had never approved, effectively bypassing legislative authority. At its core, the clash reflects a broader constitutional standoff, whether an executive agency can delay or redirect funds already appropriated by Congress. And as both sides traded blame in real time, the hearing revealed just how high the stakes are for childcare access, medical research, and public health infrastructure nationwide. If Congress approves the funding, but the money never reaches families, researchers, or childcare centers, who's really in control? Stay informed, stay engaged, and if you believe accountability in government should never be optional, make sure you subscribe and join the conversation, because Americans deserve answers when billions are on the line.